Hi, I'm Dr. Sheena Carter. This is a recording of information presented as part of a DPC course for parents of children who were cared for in neonatal intensive care. We have regular classes twice a month on topics of interest to parents of the children we follow. You can find a link to the information on the classes at the website listed on the screen. In this class, we will be talking about discipline and healthy emotional development. The emphasis will be on managing behavior for children with complex medical history who often have developmental delays and doing so in a way that promotes healthy emotional development. What do you think when you hear the word discipline? Most parents have certain expectations for their child in terms of eventually being able to follow rules. People also use discipline to refer to training to improve strength and self control. Self-restraint often comes up as something that's important for children to learn. Part of becoming a mature person is learning what is expected and being able to control ourselves when we want something that we can't have. Tantrums over this are often the first time parents realize they need to start thinking about discipline. Parents in our class have talked about the need for order and for children to adjust to routines. Often people mention correcting behavior. Frequently people associate discipline with punishment, even to the point that sometimes people think of discipline and punishment as having the same meaning. Training to improve strength and self control or self restraint are also important. But it's common to assume that discipline should be painful. When I was growing up, a common phrase we heard from our parents about discipline was, "This hurts me more than it does you," assuming that discipline needed to be painful and acknowledging that it's unpleasant for parents as well as for children. Which brings us to emotional development. We want to make sure that whatever ways we choose to respond to a child's behavior, we're choosing ways that support healthy emotional development and not undermining emotional development. This is especially important to parents of children who have a history of serious medical illness and to parents of children who are worried that their very young child or child with developmental delays may not understand why their behavior is problematic, or parents that are concerned that their child's behavior may be a result of their early illness or NICU stay. Not only have these children already experienced a great deal of pain and distress, they often have some long term difficulty in coping with stress. So, of course, there can be concern that the discomfort of discipline not overwhelm a child's ability to cope. Because the children in our clinic are all very young, for this class, we're going to focus on some basic principles of behavior change that don't require the child to understand language or consequences. We're going to talk about some principles that work for children of any age and how to respond in ways that actually help children feel more secure, confident, and safe rather than increasing their stress beyond their ability to cope. First, keep in mind that most behaviors can be changed by changing what happens just before and what happens just after the problem behavior. That is, if you could just take a step back and watch for a few times when a behavior occurs and pay attention to what's happening right before and what happens right after the behavior, you can get a lot of information about how to recognize when the behavior is coming on and when it may be able to, you may be able to make some changes to avoid the behavior altogether, but you also may be able to change what's happening immediately after that behavior because behaviors that are immediately rewarded or reinforced will happen more often and behaviors that are punished will decrease. With very young children, the consequences need to be immediate, not wait until you get them home, for example, but immediately. I'm going to suggest that you focus on finding ways to reward or strengthen behaviors that you do want to see and try to make sure that the behavior that you don't want is not getting rewarded. Because if a behavior is very frequent, and especially if you see that it's increasing in frequency, it is getting reinforced. So you need to try to find out what's happening to reinforce or reward that behavior and what can you do to prevent it. So the reason I'm suggesting you focus on rewarding behavior that you do want to see rather than focusing on punishing behaviors to decrease what you don't want to see is because number one, positive rewards for good behavior are a lot more effective than trying to punish unwanted behavior. And also, punishment tends to come with some negative effects that no one wants, including making the child afraid and resentful of the person giving the punishment. And especially with young children, it's a risk of that they will start to imitate the punishment. For example, children who are punished physically tend to become more aggressive, and they see you hit when you're angry, so then they hit when they're angry. And children preschool age and below just don't have the ability to understand all the explanations about sometimes it might be okay to hit, or sometimes it's wrong and sometimes it's not. They just don't understand that. In fact, children of any age, when they're very distressed, are likely to have the mental capacity of a much younger child because people just tend to regress a little when we're upset. Children do the same thing. So if a child is very distressed and a punishment to be effective does have to be upsetting, then punishing the distressed child just increases the distress. And if what you are punishing is a distress behavior, like crying, for example, or something else that a child does when they're distressed. And a lot of times you'll find out that the behaviors you're trying to get rid of are just that, then you're making it worse. You're actually increasing the behavior that you're trying to stop. I don't mean to imply that you need to keep your child from ever being distressed. Distress is normal and it lets us know something's wrong. But we're hoping that the overall message the child gets is that the parent is a source of safety and comfort, not distress. They may become distressed when you start working with them on self restraint. That very distressing lesson that you can't have everything you want when you want it. But ultimately, the lesson is that you can help them tolerate their distress and learn to put off immediate satisfaction so that they can learn to adjust to rules and follow a schedule and be very safe and successful at getting even better things. That's a hard lesson, but it will take a lot of consistent, repeated consequences. But remember, the parent has the most important role in helping to build healthy expectations and patterns by consistent, contingent responding. Consistent meaning responding the same way each time, developing a pattern of responding. So that's consistency leading to a pattern. And it's contingent, meaning the way you respond depends on something that the child does. It's not necessary or even possible to always do the same exact thing every time, but it is important to have some patterns, some things that you repeat enough that the child learns what to expect. This starts in infancy, being able to engage with an infant by responding to the baby's cues in a consistent manner over time. That actually comes to create the relationship. You want the child to develop a sense of you as someone who is dependable and a source of safety and strength that they can rely on. You establish this by showing them over and over that you are reliable and consistent. And as they grow and start to learn how the big scary world works, you have to be there to show them where the edges are. Where are the limits? Where are the boundaries? Setting limits and establishing schedules and routines helps build a child's sense of safety and it makes the world less scary. So while they may have some distress when you say no, they will. They will also learn that you can help them learn how to get to yes, and that you're a dependable person who will help keep them safe while they figure it out. Don't forget to work on the yes. Remember, we're going to be rewarding the behavior that we do want to see, rewarding the behavior that gets to yes, rewarding attempts at asking, even if they don't always get the words right or even the sounds right, rewarding their efforts as they get closer and closer to being able to stay within the boundaries and follow the rules and keep away from the dangerous edges. In the group discussion for this class, we talked through some examples. One example that several people in the group could relate to involved a twin who refuses to eat, throws food. Now, picking just one of the problem behaviors, we can take throwing food and watch for what happens right before. Let's say the food throwing happens after he's only taken a couple of bites of food, and then that 30 minutes not eating while his twin did eat. So the immediately before is probably sitting and not eating. The immediately after is the twin laughs and throws her food too. So to change what happens before, we can start with putting only a couple of bites of food on the plate. And if we know that's all the child is likely to eat, then that's a good place to start. And actually, if over time you see that he only eats a certain amount of food at each meal before the behavior challenges start, I would just recommend starting with half that amount of food. That is half the food he normally eats. And then if he eats that, you give lots of praise and definitely give him more if he indicates he wants more. The goal is actually to have him letting you know he wants food and feeding himself. So reward the behavior that starts to work toward that. Now, to change what happens after, remove the food dish earlier. Again, it's better to remove it too early and have him indicate he wants more. Don't try to make him sit there any particular length of time. I would work on establishing a new pattern where you give him a little less than you expect he would eat and reward him for asking for more. Even reward him for eating his 2 bites by saying he can go play. Work on making meal times more enjoyable and less stressful so that it's something the child wants to participate in. This can be really hard when there's a well-established pattern of struggle at mealtime, especially for children who have strong negative reactions to things going in their mouth and a history of being rushed to more advanced feeding before they're ready. Toddlers usually have a strong desire to control what they eat and to feed themselves. And this can be very complicated and frustrating when fine motor skills are weak so that they can't easily pick up food or use a spoon. If this is the case, try to offer foods that the child can easily manage, if at all possible, and allow plenty of time, helping only as needed. Try to relax about how much the child is getting in at any one meal and focus first on making mealtime a pleasant experience. It can take a lot longer for children with a history of feeding difficulties to work up to taking in enough food by mouth to sustain their nutritional needs. So just accept that you may have to use supplemental formulas, Pediasure, until they increase the volume and variety of food that they will and can consume. So it just isn't something that you should try to rush. Always start with a single behavior, try to understand the cause, and make sure you know what is developmentally appropriate and how your child's particular medical and developmental issues may contribute to the problem. Often the sensory problem or delay that caused the problem will have resolved, but the problem behavior continues. An example is a child that no longer gags easily, but still refuses to try much variety in textured foods. Watch for a couple of days until you can identify what usually happens before and after the behavior starts. Change what you do before, change what you do after for the next 3 days. Then write down each time the behavior happens after you've tried something new for a few days. Use what you learn from this exercise to come up with some structured routines that will help make sure that you're rewarding the behaviors that you want to see and not spending as much time trying to stop the behavior you're trying to stop. If you find you're still spending more time responding to the problem behavior, back up and set expectations that you're sure your child can meet before moving forward again. With the food example, this may be starting with putting one piece of finger food you know the child likes on his dish and then praising him for picking it up. It's fine to back up that far, then even further if you need to. If you work through using these suggestions on a problem behavior without seeing some success, or you feel like you need more help with a behavior plan, don't hesitate to call your DPC nurse practitioner or one of our psychologists and ask for additional behavioral consultation. We're happy to help you find a behavior therapist if needed. And please don't feel bad to ask for one, as behavior can be very tricky to manage for children with complex medical histories, and a little professional assistance can be extremely helpful. And here's my contact information if you need to get in touch with me. And if you don't already have our website, there's the link so you can find other information there. Make sure to let me know if you want to be on our Zoom list for our regular Zoom classes.